All right, well, welcome back to another video of the Excellent Physician Project today. You know, in the last video, we talked about why you should put together a medical kit and how you should start thinking about that, some important questions that will really go into designing the medical kit. And in this video today, what I'd like to do is I'd like to go through the medical kit that I put together that I use. Now, I did mention that I have a number of different kits, a number of different sizes for different purposes, but there's one that I put together that's kind of a general purpose bag that I thought has been super helpful for us, and I think would be a really good, just kind of an example of what a good medical kit should look like. So with that being said, let's look at this medical kit that I have for us today. So this kit is basically a general purpose kit that I put together. You know, originally it was designed to be included in our camper trailer. It's something I'd take with us when we go camping. And, you know, I do put it there, but I found that it's been so helpful. Like there's so many good things in here that it generally doesn't live there. It lives kind of wherever I am and wherever I've needed it most lately. And then when we go on our trips, then I just throw it in the trailer and it works for that. And then I pull it back out when we get home. So with that being said, let's dive on into this one. All right. So as we start with this kit, just going from the outside in, the first thing is the bag that it's in. And so we'll start with the external portion of the bag. You know, I got this one largely because of its size. It is big enough that I can really keep a lot of important stuff and a lot of helpful stuff in here. It can be a very robust kit, but it's also small enough and compact enough that it fits into kind of some neat and small places. You know, like I said, it was originally designed for our camper trailer and it's supposed to sit on a shelf in there and not be this huge heavy thing taking up a lot of space and weight. So it's actually, I really like it. It's a perfect size. You know, externally it's got a whole bunch of pouches. It's a, you know, black tactical looking bag. It's got a bunch, I like the Molly straps where you can attach things to it. Although this one, you know, the size really doesn't need a lot of things attached to it. My big backpack style, I have some other attachments that kind of add pouches to it using the Molly system. But really, you know, it's a good size. So this one is produced by Victory Gear. It's a Shangri-La size. If you're looking for that, it's on Amazon, and it has a bunch of great pouches. So let's dive into kind of some of the pouches that I have here. So as we dive into the bag itself, right, I've organized the things in this bag based on what am I going to need quick access to, and if it's something that I need right away or a lot, it's going to be more exterior. If it's something that I have a little bit more time or just kind of more detailed supplies, it's going to be deeper inside the bag. So as you put your bag together, think through, what do I need to have right away? What am I going to get access to? Do I need to tear things out to get to the things that I'm going to use? That's going to be kind of obnoxious if you have to do that. So right off the bat, the top pouch right here is just for super basic supplies. So in the top pouch, you know, I have a little carabiner with some paracord, just, you know, having a cord just to hold some medical tape here. And then I have in the little web straps, just a bottle of hand sanitizer, just so that when I'm out and about and I need to, you know, prepare to take care of someone, I can clean my hands, disinfect my hands in that scenario. I do have a chem light. And then in the top pouch, this is going to be my basic, simple wound care, right? So complex wound care is going to be down inside, but something that I'm going to need to get access to a lot. Like if someone skins up their knee and they need a Band-Aid, things like that, they're in here. So in this pouch, you can see it's pretty stocked full of stuff. In the front, I have just a whole bunch of, you know, alcohol prep pads, and then just a pile of Band-Aids. So when you're putting your kit together, don't forget to include just the simple stuff, the Band-Aids. You know, I went and bought a box of varying sizes Band-Aids, threw some in here, you know, because honestly, that's going to be a lot of, you know, when you have a first aid kit or a home med kit, that's gonna be a lot of what you're going for, is just kind of these simple Band-Aids. And then beyond that, you know, if I need to do a little bit more advanced wound care, if it's something a little bit deeper where I need to get into some laceration repair, I have some simple ability to do that. So the next level up is gonna be steri strips, right? So I can clean it out, I can pull the skin together with a little bit of a steri strip cleanse or you know, type dressing. And so I have, you know, a couple packs of steri strips here, right? You can get these on Amazon. So these are the 6mm by 75mm, 3 strips per pack. You know, honestly, you never really need all of the stuff in here. And when I get these out and use them, they're really, really long. And so what I end up doing is you know, whatever pack I get out, I end up opening it up and then cutting it in half, so that I have something. So in this situation, it'd be 75mm, so it's gonna be, you know, 37-ish millimeters of length. And that's generally speaking enough to kind of pull a wound together. And then it goes from 3 strips to 6 strips. And then what I've found to be really helpful at work, and I've used a lot, is this tincture of benzoin compound. So this is an adhesive thing or liquid that allows you to just kind of rub it on someone's skin on either side of a wound. You let it kind of air dry to sticky, and then it causes those steri strips to stick a ton better and really hold a lot better as you're doing the wound care. So I bought a pack of, a bunch of that on Amazon. You can get a box of these things for pretty cheap. They're like a single-use snap vial, so you snap the glass plastic vial, and then it causes the tincture to come down on this, felt applicator, and you can rub it on the skin. If I want to do kind of the next level up, I do carry super glue with me. So you can buy medical grade cyanoacrylate type of glues. Honestly, most of the material is going to be about the same if you just go get a pack of just super glue at the dollar store. So I got a 4-pack of super glue that I keep in here. I use this all the time for fixing wounds. You can kind of hold that wound together, super glue on top of it. Or what I love to do is put steris on and then super glue on top of the steris to hold it down. So it's maybe not quite as flexible as the medical grade cyanoacrylate glues, but it certainly does the job and gets the trick done. And what I really like to get is, especially for the kits, is these single applicators, because once you open it up, it really doesn't keep very well. And so I consider this to be a one-time use thing. I can open this up. I have 4 applications here, so I can take care of 4 different wounds before I have to go restock. So single-use super glue is super helpful in this scenario. So that's the top compartment. That's gonna be most of my basic wound care supplies and things that I need. As we move over to the side, there's 2 side pouches in this thing. And so in this pouch here, I have basically included hemorrhage control things. So as we talked in our previous discussion, the most emergent thing, the most time-sensitive thing that we're going to be taking care of in the field is probably going to be bleeding control. And so I want to have easy access to something that I can use to stop bleeding or to control that bleeding. So I usually keep in all my bags on an external pouch something that I can stop bleeding with. Here is a it's a vacuum sealed emergency pressure bandage. You can buy a pack of a couple of these on Amazon. Alongside that, I have 2 cat tourniquets. So these are great. They're a little bit of a tourniquet that you can put around. You can cinch down the Velcro, and then the windlass here you use to twist to get that extra level of pressure to really stop that arterial bleeding that you're going to run into on extremities. And I keep these everywhere. I have just cat tourniquets in my truck. I have them in my bags. They're pretty cheap and they're pretty easy just to throw different places, and can honestly be super helpful if you're ever in that situation. So as we turn it around and come to the other side, I have my other kind of quick access pouch. And in this one, just a couple supplies here. The big thing, the most important thing that I have in this side is a little bit of a handheld battery operated pulse oximeter. And so this one's great because, it's really portable. They're super cheap. You can get them I got this one on Amazon again. And it's something that you can essentially just throw on a patient while you're getting the rest of your assessment, and you can start getting some basic vital signs. And so it will show you, this one has a readout for your pulse ox, right? The oxygen saturation in your blood, as well as a heart rate monitor. This is the Santa Medical. I have this one and I've had another one. Both of them are fine. But what I like specifically about this one, and the reason why I got this one, is it has a readout, a graph on the bottom here that shows me the waveform of the blood pulse that it's analyzing, right? So I can know that I'm getting a good solid normal waveform and that pulse ox is accurate. That's what I really like about this one. It's a really good cheap tool to kind of help get some vital signs as you're assessing a patient. The other thing in here, I do keep a bigger thing of Gorilla Glue. And then I have a thermal blanket. So this is one of those space blankets that if for some reason I'm ever out in a cold environment and need to warm up, this could be useful for some environmental exposures. And then finally, just an EMS first or field guide. You know, I bought this years and years ago when I worked EMS. As at this point now, you know, in my medical career, I hopefully know more this and more just intuitively because of practicing for so long. But if someone else who's not me grabs this bag and doesn't have a lot of first aid experience, then here's just a quick flip guide where you can kind of get through some basic emergencies, and here are my steps 1, 2, and 3 as you start working on that. So I do keep that in there, mostly because I had it and I needed a place to put it, and it just seemed like a logical place, in case someone else was using the bag. There's one final external compartment, and that's the big broad one here on the side before we get into the inside. And so this one is where I just keep tools and instruments just because it's big. It's kind of like an admin pouch. It's always good to have a pen, something to write with. In case you put a tourniquet on, you can write your tourniquet time. If you have, scratch some notes about something. I also like to keep a knife or some form of a cutting instrument in my kit. This is just a pretty simple Swiss Army knife that I happen to have on hand, and tossed it in here. And then light sources. So one of the things I'm pretty obsessed about is having a source of light. And so I have a ton of these little flashlights. And then getting into some of the other instrumentation here, I do keep a pair of trauma shears in here. So trauma shears are really, really, really helpful. You can cut all sorts of things. It's just kind of a general universal cutting instrument. And so if you need to get exposure and cut, some pants out of the way or something like that, or if you're, cutting up your Curlex and your gauze and need to kind of shape that or cut that off, you can use the trauma shears. There's all sorts of different types of shears out there. A lot of my colleagues use the really, really expensive multi-tool shears. And honestly, they're cool. They have a lot of stuff that you might be able to put a lot of tools in one. But personally, I find that just the cheap trauma shears is really all I need. This one I think was a multi-pack, so I got two sets of shears. In the pack, it's got a little carabiner clip. I never really use a carabiner clip, but this is what I use when I'm in the emergency department. I have an orange pair just so I can see them if I set them down. And I have multiple pairs elsewhere here and in my office at work and my other kits. So trauma shears are really a must-have. And then when it comes to other instrumentation, one of the things that I talked about last time was the choking episode that we ran into. And so that could happen. So I keep a pair of McGill's forceps if I need to, try to extract something from an airway. And then I bought on Amazon just some basic instruments. So we have, a curved hemostat, a straight needle driver, some suture scissors, just some other instrumentation there. And then you'll see later I have a stapler, so I need to have the obligatory staple removal device. And then in here, a CPR shield. And then finally down here, if for some reason I need it, I do keep a scalpel. So this one is a 10-blade scalpel if for some reason I need some other just sharp cutting instrument. So that's kind of the miscellaneous tools in the admin compartment. So the final compartment in this particular bag is the main internal compartment. I'll turn it around here and we can take a look at that. So it's got a top zipper. This particular bag does allow you to unzip it and kind of splay it open a little bit. Although I find that it doesn't really splay open and lay flat, and I don't really need it to do that for my purposes. But this is going to have the bulk of the material that I carry in this particular bag. And so as I've thought through it, what are the things that I'm going to run across? What do I need this bag to do for me? And most of it is going to be in the form of wound care, right? There's going to be some hemorrhage control, mostly wound care. So the one deviation from the basic wound care is I do carry some basic advanced stuff for thoracic injuries. And so in particular, in this top pouch, I do carry two 14-gauge angiocaths so that if I ever run across a situation where I'm, with someone who has a tension pneumo, I can decompress a chest. This is something I picked up on Life Flight when I was working. I always carried these in my flight suit, had them in some pen pouch, and I've just gotten in the habit of all my pretty big kits have 14 gauge angios. Along those lines, I also carry a chest seal. I have a 2-pack of chest seals in this main pouch here. Again, this isn't supposed to be a massive, multi-trauma kit, but a couple things that if I can be prepared for, intervene upon, and fix out in the field, that may just save me a few headaches down the road. So pretty light, pretty slimline. I can fit those in, not a big deal. As we get further into here, I have a couple rolls of gauze roll. These are great for just general wound management. So I put on some gauze, I can wrap them up, either get some padding or just get some wrap to hold some gauze in place. So I have some gauze roll there. In this compartment here, there's kind of like a little sleeve compartment. I carry 4x4s. So these are the bulk of most of my dressing supplies. Got these on Amazon. Again, they're single pack gauze. And so what I found is you can buy gauze in a couple different formats. You can buy it as a single pack, or you can buy it as just this big package of gauze, right? And it's just a whole bunch of plies of gauze stuffed together and packaged up. That's really not helpful for these medical kits, largely because you get 100 plies of gauze and they're not individually packaged, and now you just shove them down here and it gets everywhere and they get dirty. So having these single packs are really helpful because when you need them, they're clean, they're sterile. You can just pull this out and use as many as you want, and then you can just resupply them. So I have a ton of these in here for wound care, right? In addition to that, what I found to be really helpful as a base layer for wound care is going to be some non-adherent gauze or non-stick gauze. This just has non-stick material, and it's really nice when you put this down as a first layer, because what's going to happen as you bleed, right? That blood's going to soak into whatever porous material that is on your wound. And then when it clots, it hardens. And so when you go to take that off, it's much more difficult to get that gauze off. You rip the wound open, you cause a lot of pain. But if you put this non-stick on, this is a pro tip, right? If you put this non-stick on, it's a lot easier to peel off, a lot more pleasant, a little less traumatizing or re-traumatizing to that wound as you're taking your dressing down and redressing it. So I definitely like to keep some non-stick gauze kind of as a first layer. And then the other thing in the vein of hemorrhage control is quick clot. So I do keep some quick clot in this kit as well as in my bigger kit. And this is basically, if you're not familiar with it, just a hemostatic dressing. So it's a gauze with a hemostatic agent in it that really promotes clotting. And so if you have a wound that's just bleeding more heavily than normal, this is great. You can put this down kind of as your base layer, or pack that wound with this, then put your dressing on, wrap it up real tight to really try to get hemostasis in that wound. I've had a couple different versions of this. They do make a powder version that you can dump into the wound, but that's all messy. And so I find that the gauze version is a lot nicer because you can put it in, you can pull it out a lot more easily, and it's small, light, and it's something easy you can stuff in your kit. So that's gonna be a lot of my wound supply pouch. As I get into the main pouch, we're gonna have just a mix of things. And so on the theme of wound care, I do like to carry some suturing type material. I'm trained in doing sutures, and it's something that I'm comfortable doing. And if I can do this out in the field, I can potentially save myself a trip into the emergency department. If you're not comfortable, obviously, I would caution you to not necessarily feel like you have to pack this in your kit. In fact, really don't pack anything that you're just not comfortable using or not going to use. But for me, I am comfortable doing wound care and following that. And so it's something that I'm going to put in there because I've had a number of occasions with my children that I've fixed their wounds. And I've even had an occasion where I've had to have someone fix my wound with a staple kit. The first big thing is a skin stapler. So this is just a generic disposable skin stapler. Again, bought this off of Amazon. You can get a lot of stuff there. It's got 35 staples in it. You never need all 35, hopefully in this scenario. Generally you need 3, 4, 5, 6 at most probably. But it's really helpful to have this if you need just a quick skin closure via staples. So like I said, for me, I cut my head a couple months back, and in a few minutes I was able to teach one of my friends how to use it. And then he popped 4 staples in my head, and we were great, and is a good example of how we could use this kit to fix something and really, save us a lot of time and headache. The other thing that I keep here is a little pouch that has some suturing supplies. So again, I'm going to have some instruments, although some of the instruments that were in the front pouch need to go back in here. But in here I have a little bit of lidocaine cream. Never really works all that great, but it's my attempt at providing some anesthesia. And then I was able to find some sterile sutures of different sizes that I can use if I actually need to do like a needle and thread suture. Someone was asking me once if I would recommend just using a regular needle and sewing thread, and asked how you would sterilize that. And my response was I probably wouldn't recommend that. If you really are that hard up and need the stitches, just temporize the wound the best dressing you can and get patients to the emergency department or urgent care, because there's really no way of sterilizing just a regular sewing thread. Like if you're going to try to burn it, you're going to burn the thread. It's also a multi-filament thing, so your risk of infection goes up. And so either get the sterile stuff or just temporize your wounds to get to the emergency department. Like I said, since I'm comfortable doing wound care, because I do this all the time for a living, I do stock this in case I need to do sutures. The other thing that I keep in here, mostly because it's more delicate and I want to protect it, even though it's not necessarily wound care related, is a pair of alligator forceps. So these things are great. They have the little elbow bend and a very teeny tiny fine point gripper that you can use, and these are great for extracting foreign bodies from things. So if kids stick things in their ears or in their noses, it kind of has that nice little fine point where you can get in there and grab at the thing. And then as we go through the rest of it, we're going to start transitioning more towards orthopedic extremity fracture type supplies. And so the next item here is SAM splints. So I have 2 of them here, and these are not the SAM brand, but it's that same concept. It's a piece of foam with some flexible metal inside. So you can basically open this up, you can create it into the shape of the splint that you want, mold it around an extremity, and then use your gauze wrap or gauze roll to wrap on top of that to really hold this in place, and it can be a form of splint. So I keep 2 of them. I can either splint 2 extremities, or if I need to do like a posterior slab and a sugar tong style splint, I can do that with both of these. In that vein, you're going to put that on. You can either do your gauze wrap as like a padding or on top. This isn't going to be the final splint, but it's going to be enough to get you to your next stage. But as the final top layer for that, I keep a couple ACE wraps. So these elastic bandages that you can wrap across the top to really hold that thing in snugly, get some pressure. These also are great for wound management. If you put on gauze in your gauze roll, then you can wrap this on top. It's just kind of a nice final cover that holds everything with a little bit of compression, kind of makes it look nice. And then if I need some form of sling, what works great is these triangle bandages. It's just basically a ginormous triangle, and you can tie it up in different configurations to create slings and various different things that'll help out with the orthopedic issues. And then the final thing in here is I have a whole bunch of ice packs. So there's a little pouch over here with a couple ice packs, and these are just the standard single-use disposable, kind of squeeze and you break the little bag inside, and it mixes together and just creates a nice cold pack. And so again, orthopedic injuries, someone's spraining their ankle, whatever, use a couple of these. It can really help out just with some of that pain and swelling. So that's really the kit that I keep. I found that this really serves a lot of the different needs that I have when I'm out in the field. I've intentionally left things out just because when I'm going to use this, I don't need extra supplies. I don't have a stethoscope and blood pressure cuff in here. Yes, I don't get a full set of vital signs, but honestly, if the patient is that sick, this isn't the end kit that I'm going to need. I'm going to be calling 911, getting the patient out of there, or trying to get them to a higher level of care. And this isn't going to be the keep me from the hospital kit. So this is really to keep me, on the road, keep me out in the field, keep me enjoying the things that I want to do, type of a kit. So I hope this is helpful for you as you think through how to put together your kit between the last video where we talked about some of the philosophy and the theory behind it, and this video where we looked really practically at what I have in my kit. So if you like this type of material and this content, be sure to hit that subscribe button and hit that notification bell so that every time I post up a video, you'll be notified about this. If you want to learn more about kind of physician life, you want to learn more about how to pursue excellence in life and in your work, head on over to the website, excellentphysician.com. I try to write blog post articles about things that I'm thinking about pertaining to being a physician, about pursuing excellence, how to kind of optimize your life. Put that over there on the website. Thank you guys for watching. I really appreciate it. If you have any questions or comments, definitely put those in the comments below, and I'll look forward to seeing you guys in the next video. See ya. Bye.